Um, and welcome. My name is Heidi Schumacher. I am joined by my colleague Nick Connor for this first in our webinar series on chronic absence, and really spotlighting some great work happening across Vermont. So welcome. Thanks all so much for joining us. I will ask everybody as you join, please do mute your line. We'll have lots of opportunity for participation, but request folks mute. And I think with that, we'll get started. Can everybody, Nick, just confirming screen, the slides look good?
Yeah, looks great.
Perfect. All right, so I think are going to pose to you a question for all of you out there listening. Imagine no matter what your role, we have school folks, we have healthcare folks, we have data folks, other folks from the community. What if, as you approached your work every day with kids and with families and communities, what if you had one measure? One measure that could tell you, are the kids and families you're serving okay? Do they have their basic needs met? Do they feel safe? Do they feel supported and loved? Do they feel like they, belong in the world and have a purpose? And also for you as professionals, what if you had one measure that could give you a sense that all the work you were doing was likely to be successful, to be received, internalized? Because we're going to try to convince you that measure does actually exist. And that measure is chronic absence or school attendance. So stay tuned. Again, my name is Heidi Schumacher. I'm a pediatrician at UVM and work with the Vermont Child Health Improvement Program, where we do statewide work all across Vermont to really improve the health and well-being of kids. I spent about 10 years before this role working in a state and local education agency in another jurisdiction as an assistant superintendent. And that's really where I found a passion point for attendance as an opportunity for partnership. And I'm joined by Nick. Nick, I'll let you introduce yourself.
Hey everyone, I'm Nick Connor. I wear a couple of hats in this space. I'm the Director of Student Engagement and Data for Montpelier-Roxbury Public Schools, where I get to support a lot of young people and families with ensuring they're able to be here in school. I'm also a senior fellow with Attendance Works, which is a national organization really working to drive forward best practice and policy on chronic absenteeism across the country. So excited to be here.
And would love for folks, if you're up for it, would love for you to put your name and your role in the chat. Just curious sort of who's out there. I'm seeing a lot of familiar names, but a lot of folks who are joining again from many different sectors. So again, welcome folks. Put your name, your role, your organization in the chat, so we have a sense for who's on the call today. This is, as I mentioned, the first in a spring Zoom series, which really is going to focus today on sort of root causes and best practices foundationally. But throughout the rest of the series, the anchor is really going to be spotlights of terrific work happening across Vermont right now. So you're going to hear from folks, both national leaders as some facilitators, but really especially your colleagues who are doing great work in communities all across the state to really advance collaborative approaches to school attendance that really build on the foundations you'll learn about today. So if you have questions on any of these, again, we'll have information and links later on, but hope you'll mark your calendars. All of these are Wednesdays from 12 to 1. All of the sessions are going to be recorded too and put on our website. And this work really builds from work that Nick and I were both part of in partnership with many of you online last year in a project called Everyday Counts, which really tried to lift up technical assistance, resources, and training for both schools and healthcare providers with deep dives in 4 communities across the state that you can see with the red stars. And then we also did a fair amount of state level capacity building, including a state level summit in November, which I know a number of you were able to attend. And these sessions in this Zoom series really build from some of the sessions that we had in that state summit. So today's focus, again, which is going to be sort of a foundation to the rest of the series, we're going to talk about things like, what is chronic absence? How is it different from truancy? Who's impacted? Why are kids missing school? Maybe you're also saying, why is a pediatrician one of the people up here presenting on it, sort of what's the connection to health and well-being, and then really walking through some foundational principles for how schools and partners can prevent and respond to chronic absence. And we're going to spend time both today and throughout this series in various places talking about this triangle, because we know, of course, academic achievement, school engagement doesn't happen in a bubble, right? A child is a child who fits multiple different sectors and spaces. And of course, we know that health and educational attainment are inextricably linked, and much of that relationship is really undergirded by social factors, especially poverty. So we're going to dig into some of this intersection here, as it may help you, regardless of your sector, think about ways to get involved in this work. Okay, so guys, I'm going to try this out. I hope this works. I don't know if folks are familiar with Mentimeter, but it's a kind of cool interactive tool. So if everybody out there, you can get your phone out and scan the QR code here, or you can type menti.com into your browser and then add this code. And this is one of a few opportunities for you all to get engaged and give us your feedback. So first question is, which of the following, quote, count toward chronic absence? So you can pick one or multiple of these, but just trying to get a sense for what folks are sort of coming in with in terms of experience here. Which of the following count toward chronic absence? Unexcused absences, excused absences, and or out of school suspensions. I'm going to give it just a minute here. And while you answer, the cool thing is, if you have this open on your browser or on your phone, now you'll be able to follow along the rest of the presentation, including future participation prompts from that same browser window. Okay, here we go. Let's see. Which of the following count toward chronic absence? All right. So 100% of you said unexcused absences, and a slightly fewer said excused and out of school suspensions. And dun 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 dun. The answer is all three of these actually count toward chronic absence. So we'll talk a little bit more about definitions, but unexcused absences is really where we think about truancy. Chronic absence counts all three of these equally toward that definition. Okay, so that's terrific. Thank you for participating. And then our next sort of foundational question, how many days per month does a student need to miss to be considered chronically absent? This should show up as a multiple choice. 1, 2, 3, or 4 missed days per month. So I'm going to give it another 10 seconds, maybe. Okay, let's see. How many days per month does a student need to miss to be considered chronically absent? So a few said 1, many said 2, and a few said 3 or 4. The answer is, I wish we could do a drum roll audio here. The answer is 2. 2 days per month is what it takes to be considered chronically absent, which I think a lot of folks are surprised to hear that, because that feels like maybe not that much. And we'll talk about how the impact of those absences really adds up over time. Okay, terrific. Thank you. So we're going to go into a bit of a presentation, and then we'll come back to some more participation. But just to anchor us in those definitions, so we already started to bring out some of these core concepts, but truancy, I think, is the model that most of us are familiar with, right? I know I grew up with the truancy-based model. I feel like that's still a term that many of us use. Truancy counts only unexcused absences. And what I think most people know about it is the scary letters that we get with those truancy identifications and notifications. It's rooted in compliance with the law, and it has a pretty compliancy response and a compliance mindset. You can see this at the bottom. And increasingly over the last number of years, and our state is really moving strongly in this direction currently, is really more to think about chronic absence instead, which counts all absences regardless of cause, regardless of excused, unexcused, suspensions. Because in the end, it doesn't actually really matter if you have an excuse note or not. in terms of the impact of that absence on the child's ability to learn and access all those other services in school. So really, chronic absence has not only a more holistic definition of what types of absences count, but it really typically comes with it a more holistic response also, and really moving from the compliance mindset of truancy to more of a connection mindset in chronic absence. I'll also say here again, you can see circled at the bottom right, chronic absence is defined as missing 10% of the school year for any reason, excused, unexcused, out of school suspensions, which averages, as we were just talking, to 2 days per month. One of the things I think is most powerful about chronic absence is that 2 days a month can be calculated anytime in the school year. So you can calculate chronic absence in September. And you know that actually the kids that are chronically absent, missing 2 or more days in September, are 5 times as likely to be chronically absent throughout the whole year. So one of the powers of chronic absence as an indicator is we don't have to wait till you hit a certain threshold of missed days as we do with truancy. We can really get started from the very beginning, thinking proactively about how we try to prevent and respond to those missed days. So who's impacted by this, and why all the focus, why all the hullabaloo about chronic absence in the year 2026? Well, the answer is that that little pandemic that we had a few years ago really sent rates of chronic absence skyrocketing. I would argue they were too high even before the pandemic, mid-teens percentage. These are national data here, but rates across the country about doubled in the early years after the pandemic. We've seen some improvement, but we're not even close to where we were pre-pandemic. And in Vermont, we see similar rates. So our rates pre-pandemic were in the high teens. We got up to 40+% in the first full year for which we have data after the pandemic. And we've seen some improvement for sure, but still 1 in 4 kids in Vermont is missing that 2 days a month or a month of school over the course of the year. On this, I'm sure you've seen these headlines. These are a combination of national headlines with some local headlines, lots of discussion about this crisis of absence. I love this. I'll include this headline in every connection that I have on school attendance forever, because we know pre to post pandemic, people's relationship with school changed. Families, students feel differently, perhaps, at least in some communities, about, has school become optional? Does it feel less required, less critical to be in person every single day now than it did 5 years ago? And so in the end, 1 in 4 students is chronically absent. And we know this is not a universal story experienced by all kids and families and communities. So I'm curious if folks out there know what your rates of chronic absence are, but across the state, about 25%. But certain communities and certain kids within your community are more likely to experience challenges getting to school than their peers. So kids with disabilities are more likely to experience chronic absence here in Vermont and across the country. Kids living in poverty, kids experiencing homelessness. In certain communities, kids of color and kids who are English language learners also may be more likely to experience chronic absence. But this is a story of equity and a story of disparity. And I'll say those, in many communities, the rates of chronic absence rose for almost everyone pre to post pandemic, but in many communities, those gaps widened as well. So this is the kind of thing we're going to talk. Nick's going to walk us through some of the ways we can understand our own data better, but understanding who's at higher risk is part of how we have a really targeted response. And so why do kids miss school? When people ask me this question, I always start by saying it's very complicated. I'll say the thing that it is not is that families don't care. That's not the reason kids are missing school, although I still think that perception is out there. But Attendance Works, the national organization that Nick's a senior fellow of, and I'm now on the advisory board of, has done really good work to try to bucket the reasons why kids miss school, to allow us to better understand where perhaps we can intervene. So the first bucket on the left is barriers, These are the things I think a lot of people come first to these. These are things like acute illness. So when a kid's sick with a fever, they can't get to school. Maybe when their family is ill, they can't get to school. Transportation stuff shows up in barriers. Childcare. So if a younger sibling is home and mom or dad has to go to work, maybe the older sibling stays home. Safety is a thing that comes up here too. If kids don't have safe passage to school, don't feel safe on the bus. And I'll say in a number of communities, I know this is impacting especially our rural farming communities here in Vermont, immigration enforcement and folks feeling concerned about safety in leaving their home is a reason that we're seeing missed school currently. Health stuff, of course, again, I'm a pediatrician, and part of the purpose of this series is to think about linkages with healthcare folks who could support schools in addressing some of these barriers. These are the some of the barriers with the highest evidence base. Mental health and trauma, certainly this is something we talk in technical assistance with many of you all the time about, and certainly depression, anxiety for young people, especially our middle school and high schoolers, has increased dramatically here in Vermont and across the country. Asthma is another one with huge connections to absences and oral health concerns. This one always surprises me when I present. I think a lot of people tend to be surprised. Unmet dental needs and untreated dental caries or cavities are some of the leading reasons causing millions of missed school days across the country. So those are some of the most common health needs. Of course, there are many other things not listed here, but I'd say too, think about not just health things for the child, but health things for their family are leading causes of absence. How about some of the other reasons? So aversions and disengagements in my mind are sort of two sides of the same coin. These are things like, you know, maybe I don't feel like my school culturally sort of respects or reflects me. Maybe I don't think that the culture invites me as a member of the community. Maybe I don't think my instruction or my engagement there is necessary or helpful for me in my future. Maybe I had a disciplinary action one time and that made me really not so sure about coming back the next time. Again, a lot of family stuff in here too, multi-generational things. We find that when parents or caregivers didn't have a particularly positive experience in school, that has relationship with their children, perhaps not attending school as regularly. And then the last one is misconceptions, which there's a lot here. But misconceptions, first and foremost, many families don't realize how much school their child has missed, tend to underestimate, and they also underestimate the impact of that missed school. Many families also have misconceptions about the benefit of their child to being in school every day. Many families are unclear. This came out in focus groups that we just did over the last few months too. In a post-pandemic world, when is too sick for school? Is it still the like 10 days, 14 days thing after a cough or a fever? Can I come back when my kid has a cold? Does that feel right to me? So lots of misconceptions again about how much, when to send your child to school, how much is too much missed school, what the impact is, etc. And we did through our Everyday Counts project, we surveyed 300 some odd families across Vermont in those 4 communities scattered across the state. And we found of those 300 some odd parents and caregivers, basically everybody said it's very or somewhat important for my child to attend school every day. But in the next question, we said, okay, well, so how many days per month do you think is acceptable to miss? Remember, everybody basically said it's important to be there every day, but half of the people said an acceptable number of absences was 2 or 3 or 4. So there's a disconnect there, right? Folks are not appreciating that 2 days of missed school per month is chronic absence. To us, that I think, and to you all as educators, that's a lot. But to many families, that the disconnect between thinking it's important to be in school, but also thinking it's okay to miss 2 days may not be appreciated. We also asked, is it not a problem, a minor problem, or a major problem to miss a few days a month? And only a third of people said it's a major problem. We asked the same question to educators and school staff, and 83% of you said it's a major problem. So again, a disconnect there between perhaps what parents and caregivers are thinking and what you all on the ground in schools are thinking. So again, this is sort of an anchor framework to think about the complex, often interrelated reasons why kids may have trouble getting to school every day. So we're now going to turn to you. Tell us, what have you and your communities heard or experienced or seen as leading reasons for absence? This is going to be a word cloud. So again, if you haven't done it already, you can scan this with your QR with your cell phone, or you can type menti.com and put in this code. And would love for folks to enter. You can enter numerous. What have you heard or experienced are leading reasons for absences? And when more people say a given thing, the word will become bigger. So I'm going to just let this run for 20, 30 seconds. I mean, I love this, guys. Thank you so much. This is so great. Keep it going, but you can already see the bigger words, the things that are popping up a lot in the space of mental health, anxiety, depression, mental health days, a lot of transportation, a lot of sort of acute illness stuff. I'd say a lot. I'll call this in the misconceptions about vacation, a lot of things about sort of attachment or feelings of connection to the school, and then a lot of family stuff. I mean, this is brilliant. Nick, let me stop and see anything else that strikes you on this. This is great feedback.
Yeah, this is really good. I think one of the things standing out, there's several words for vacation, and being somebody working in a school district right now, this time of year, it feels like there's a lot of that happening, and it's like week after week after week. Um, we're talking about lost instructional time, right? So what I'm glad to not see on here too is that people don't care. Um, I genuinely don't think that's the case, and so glad to see that folks are not saying people don't care, because we know that's not true. It's all this other stuff that people are naming. So this is great.
Yeah, I love this. I think the other thing that always strikes me when I see a lot of these leading reasons for absences, or I think for school folks, you look at these and you're like, oh my goodness, how this is a talk on like how we can prevent and respond to absence. How can we possibly address all of these things? And as a pediatrician, I see these and say, you know what, these are the same things we're also supporting families within our primary care practices. And probably mental health, community mental health colleagues, I hope here some of you are out there. These are some of the same things that mental health teams are supporting. So I think these leading reasons for absences that are so complex, intergenerational, a lot of health and social stuff on here, just remind me as an anchor for why and how partnership can be part of the response. And we'll talk more about that. Okay, so far, with great gratitude for all of your good feedback, we've been talking mostly about sort of health and social contributors and perhaps some factors within the school environment that are impacting kids' ability to engage in their education and succeed. I'm going to spend just a couple minutes before I turn it over to Nick talking about, okay, so what's the other direction here? Like how does educational engagement impact educational attainment? That's this little loop here. And then how does that relate to health and social stuff in the long term and other long-term impacts of that absenteeism? So of course, in the short term, you heard Nick just say this, right? An absence is lost instructional time. As school leaders, of course, this is the first and primary thing that comes to mind. I'd also say, though, kids, right, when they're not in school, they also miss out on what for many is their primary or sole source of healthy meals. They're missing out on therapeutic services, PT, OT, speech language, mental health services, all the other wraparound that you are offering in your school environment. And then they're missing out on socialization and development, healthy social development. And even an absence here and there, even an absence once for illness and then 2 weeks later for something else, really impacts the ability of that young person to fully benefit from these resources in the school. But how about in the long term? One of the things I think Nick and I hear a lot is especially focusing on kids, the absences in the earliest grades. Certainly, I hear this in my personal life with young kids. The absences in the early grades it's like just pre-K. It's just kinder. It's okay. They can miss a day here or there. But what we know is, first of all, chronic absence in 1 year is one of the leading predictors of chronic absences in a future year. And the impact of those absences as early as pre-K predict third grade reading proficiency, which of course for educators, is a huge data milestone that you track towards. High school graduation is hugely impacted by rates of absence. So a study done several years ago showed that a student who is chronically absent any year between 8th grade and 12th grade, a single year between 8th grade and 12th grade, is 7 times more likely to drop out. And not earning a high school diploma is associated with poorer long-term health and shorter life expectancy by a range of, in some communities, up to 10 years of life expectancy shift. Much of that is mediated through socioeconomics, access to higher paying jobs, health insurance, healthier neighborhoods, et cetera. So it feels like, maybe chronic absence in the earliest grades to long-term a person's long-term ability to thrive might be far-fetched, but actually it's not. It's really just a couple steps from chronic absence, even in those earliest grades, to long-term impact. So with all of this, I think Nick and I really hope that folks will consider, and we'll talk about throughout this series, really using chronic absence as an early warning indicator in schools as of something that puts that child at risk, but also is something perhaps deeper that we can try to address. And then in a healthcare space, we've done a lot of work here in Vermont and across the country to really message chronic absenteeism as what's called a vital sign. So in the same way we look at a fever and we say, let's do the Tylenol Motrin thing, but also understand what's causing that fever and treat that too. The same opportunity exists for chronic absence to be perhaps an indicator of something deeper happening for that family. So I'm now going to turn it to Nick to walk us through some foundations of how we can think about prevention and response in the space of chronic absence.
Awesome. Thank you, Heidi, for a really, really great kind of foundational introduction, chronic absenteeism. I think a lot of folks are starting to hear chronic absenteeism. It was really interesting to see folks' perception of what chronic absenteeism includes. When we are talking about, this chronic absenteeism, as we said from the jump, it's every absence, right? We're talking about lost instructional time is what we want to address. So that's why we include out of school suspensions. That's why we include excused absences. All of these are lost instructional time, and that is what we're here to respond to, because that's where the research says this is the missing link, right? If young people are not in the building, even 2 days a month, we've got some serious challenges ahead academically, social, emotionally. So Heidi, as we move forward in our slides, one of the things that I always try to lift up is this pathway for change from attendance works. And this is a model that I will continue to hit over and over and over again. When we talk about what are we going to do about chronic absenteeism, how do we address this differently? What are the things that are required to move the needle on our numbers? To me, we can boil it all down to these 5 things here. To be clear, this pathway, we got to start at mindset, not a strategy. So often it's like, okay, well, what are we going to do? What are we going to do? What are we going to do? But we have to actually back it up to like our mindset of young people missing school. So we start with mindset. We then are going to talk about actionable data. We're going to talk about capacity, attendance teams, and then we'll talk about strategies. So as we move forward, Heidi, on their next slide, we've got a little bit more around mindset. And when I talk about mindset, I want to be really, really clear. This is something that I care a great deal about. We have to stop the mindset of when young people are not here, it is indicative of their character. It is that the family does not care. We need to get that out of our vocabularies completely. So rather than saying, all right, as a person who's taking attendance or reviewing attendance, I need to be a lie detector and say, you know what, I don't think this is excused, or I don't think this is a quote unquote good absence. This is a quote unquote bad absence. We need to get that out of our language a little bit of good and bad absences. We care about lost instructional time, and the first thing we have to do is change our mindset. Heidi said it earlier, we need to move from a compliance mindset to a connection mindset. We need to stop focusing on punishment and start partnering with our families. So when we think about this mindset, one of the things I encourage folks is absence is a symptom. Heidi just said it. It's an early indicator. It is a canary in the coal mine. It is one of the earliest signs that we have of a young person, like something going on. Something's happening for that young person. Everything from happening outside of school, happening inside of school, and we can trace it all the way back to pre-K. So we really need to look at attendance as a barrier. Like, what is actually going on here? It's not necessarily about that young person's value of education or that family's value of education. It is that there is something there that we need to address. I also really encourage folks to assume positive intent. We need to start to believe our families, and we want to. I genuinely believe families want what's best for their kids. While they may have different strategies to get there, they want what is best for their kids. When I talk to families all the time, oh, I'm going to mute. I think I got it. I talk to families all the time, and the thing that I hear over and over about what they want for their students is I want them to be in a better place than I am. Like, they always want their student to be bettering themselves, and the way to do that, everybody's going to take a different approach. But if we can start with the assumption that everybody wants what's best for their kids, we are in a much better place. The last piece here that I'll lift up is ask questions. We want to be partners in this work to really understand what is going on and how can we support you to be in school.
Hey,
I
JD, I'm
say
not going
this
to
and I
be here tomorrow.
see this in time. Oh,
So that
sorry, I'm navigating the mute and all these things. So I think we spend a lot of time trying to be a lie detector in places of attendance than we actually do believing our families. How many times do we hear or do we find ourselves saying, they weren't really sick, they this, or I saw Billy riding his bike down the street yesterday, he was not sick. We are spending so much time in that space versus just believe your families and actually try to understand what is really going on. They are saying that he's sick because they're fearful of some kind of reaction. And if they're fearful of our schools, it's not a great relationship, right? So we need to really unpack our mindset. And when I think about this, if you do not have the right mindset with attendance and you are only coming at it from compliance, you have to be here because it is the law and not from a place of trying to understand what the real barrier is, we're missing the mark on chronic absenteeism and how we're going to address it. So as we move forward into our next slide, I wanted to briefly mention data. So it's everybody's favorite subject, but data is really critical in this space. We need to understand what's really happening in our schools. When we ask, as Heidi said earlier, what is your chronic absence rate? I get a lot of different responses to this. Some people will be like, my chronic absence rate is 4%. And other people are like, my chronic absence rate is 60%. We need to really understand who's missing school. And when we are only some folks may only be tracking unexcused absences, as we saw from the start. If you only track that, you're going to have much lower rates of chronic absenteeism. If you carve out certain absences, you're going to have low rates of chronic absenteeism. So really making sure that we understand the concept of how we define chronic absenteeism, missing 10% or more of school for any reason. That is chronic absenteeism. We can then land on our number. The reason I encourage people to have data is if you are in a space where your chronic absenteeism rates are above 20%, which most of Vermont is in that place because as a state we're at 25%, there are some systemic things that we need to address. You're not going to case manage your way out of 30% chronic absenteeism. There is more work to be done systemically there. And so what I mean by that is start to disaggregate your data. Look at who is missing school. Are certain populations overrepresented? If I speak for our district, several years ago, young people experiencing homelessness in our district, 72% of them were chronically absent versus 20% of our entire district. Hey, there's a problem there. It is not because young people with high mobility do not want to be in school. That's not it. We need to better understand how we can support our students and families that may have certain life experiences. If you look at things by income levels, so if you're looking at your free and reduced lunch rates or your household income forms, things like that, oftentimes you will see this group overrepresented. Income should not be the reason young people don't come to school. We have work to do, right? So we need to really understand who is being impacted in this space when we're talking about chronic absenteeism. And we really need to figure out if we can dial in here, we can actually create meaningful, targeted interventions that are going to work versus just throwing stuff against the wall and seeing what's going to stick. When the reality is we're missing the mark. So I really encourage people, pay attention to your data. If you look at your data, and I see this across the country, you're going to see levels by grade. Kindergarten is very high, 11th and 12th grade is very high, and it kind of has a U shape in between. Well, kindergarten being very high is something we need to address, right? How you said it earlier. If you are chronically absent in kindergarten and first grade, the likelihood of that student reading at grade level by the time they're in third grade is significantly reduced when compared to their peers who were not chronically absent. If you're not reading at grade level by the time you're in third grade, what does that mean for middle school achievement? What does middle school achievement mean for high school graduation? All of these things are tracked, yet our highest grade of chronic absenteeism is kindergarten is right up there next to 12th grade. So we have work to do with shifting the mindset of our communities and our families about the value and importance of kindergarten. We also need to bring in our health partners because we know our kindergartners are building their immune systems and now being around all these kids and things like that. So really making sure that we have a good language around how sick is too sick, all those pieces Heidi mentioned. The last piece here I'll name is excused versus unexcused. This is something I could do probably 2 hours on. Be mindful of how you are assigning excused versus unexcused absences. There's been lots of research, most recently in Maryland and in Minnesota, where they did an analysis on unexcused absences and excused absences. It was found unexcused absences typically go to students that have identities or life experiences that align them with marginalization in some way. So our students of color tend to have more unexcused absences. Our students living in poverty tend to have more unexcused absences. Our families that go to Europe for a 10-day vacation, oh, what a beautiful educational opportunity for them, we'll excuse it. And what happens is we are kind of reinforcing the school to prison pipeline in our truancy system. We are pushing people into the court process, but we are overrepresenting certain populations in that. So I always just really want to push people to continue to evaluate what is unexcused and what is excused. Do some analysis with your data, look at who's getting these codes, and really try to unpack what does that mean for our system. So that's actionable data. We'll keep it moving forward because I want to talk about capacity here next. And with capacity, this is always a hard one, right? It does not necessarily mean this is something we need to throw a ton of money at. This is something we need to throw a ton of staff at. Attendance is something that you do every day in a school. Like it's already happening. You already have resources dedicated to this work. So this is not one more thing. This is reframing the thing that we're already doing. And so when I talk about this, I really encourage folks to develop attendance teams. You may have these in your schools already. Some schools will call them resiliency teams. Some schools call them MTSS teams. These are teams that are built already that tend to include folks like counselors, teachers, administrators, nurses. And so I am not saying you have to create now a whole new team with a whole new meeting. What I'm saying is if you have this already, make sure you're bringing attendance data to this team, and it should be incorporated into your agenda every week or bi-weekly whenever you're meeting. This is where the capacity comes from. So when we're talking about building attendance teams, these are folks I would say should be on this attendance team. First one is an administrator. I really believe that you need to have a decision maker in these meetings who is there to be able to respond to, if only we could address this bus route, for example, if only we could get our district to buy into this concept that chronic absenteeism matters. It is really important that we have decision makers in that space because attendance is going to trickle into every aspect of education. There's nothing that you can separate from attendance. Other folks that I think are really important here, counselors, social workers, if you have them. I also encourage people to bring whoever is picking up the phone in your front office when a family calls to say, Billy's out today. That person has more knowledge than probably anybody in your building about what's going on, and their voice at the table is really important. I would also very much advocate if you have a school nurse, they should very much be a part of this attendance team. Health is the number one reason young people miss school. We see this time and again. And so having a nurse or a health practitioner as part of your meetings is critical. If you can get time with teachers, great. I know that that's not easy, but having that perspective can be really helpful. The last piece here that I would add on is if you have the opportunity to bring in community health partners, those local health experts, either from your local pediatrician office or regional hospital, Department of Health, bringing folks like that in are so critical. I saw Heidi speak several years ago, and it stuck with me so much when she said what she said earlier, which was, all this stuff you're working on as a school, your housing, your mental health, poverty, food, we're doing that too in the doctor's office. And that like hit me. And I was like, wow, like absolutely, you all are doing that. We're doing these things in silos and we're working with the same families. So knowing how to bring those people to the table is of critical importance when we're talking about building capacity to address this. The next piece on the next slide that I'll hit on
Hey,
is
Nick,
really
can I just
about,
stop you for one
oh,
second? There's a
please,
good question in the chat. Have
please.
you seen schools that put students on their attendance teams?
I have seen some student voice. It's not a typical practice that I've seen. I mean, I both love that and also super important to be mindful of when we're talking about external student barriers, that confidentiality piece and how are we ensuring that we're not outing their peers' experience in ways that can get out there. But if you're doing a tendency meeting and you're doing like what we would do sometimes, a couple times a year, we do like a root cause analysis to really understand what are these levels of absenteeism, what's behind them. Getting all kinds of stakeholder voice as a part of that is really important, students especially. So great question. Last piece here, I want to talk about strategy. So this is the what do we do about it, and this is going to be included in other parts of our series moving forward. So we're not going to dive too deep here, but this is probably an image most of us are familiar with. It tends to be kind of the MTSS triangle. Some folks use tiered language. Some folks use layered language. Attendance is no different in how we do this work. So often we're used to this MTSS through discipline, behavior, academics. Attendance is no different in how we need to address this and looking at it from an MTSS perspective. So the first thing, and this comes from Attendance Works, is these foundational supports, the positive conditions for learning. This is your culture and climate, right? These are the things in your building about young people feeling safe in the building. What is that foundational support that we all need to ensure that we have in our buildings that is building the foundation before we can get into even tier 1, 2, and 3? Tier 1, we all know this is the universal level, right? This is the thing that everybody gets. This is examples of tier 1 include, are your teachers greeting kids by their name at the door when they walk into school or when they walk into their classroom? What is the universal messaging that goes out? Do you have a how sick is too sick flyer in your front office or that goes out in your mailers? That's that tier 1 stuff. Are you letting families know that to miss 2 days a month is to be chronically absent, right? Like this is about community mindset that we're setting here as well. So these tier 1 interventions are something that we're doing universally, and it's about addressing attendance across the board, building that mindset that we spoke to earlier. Tier 2 is that early intervention. So these are students missing 10 to 19% of school. Again, in September, that's 2 days. In October, that's 4 days. And a lot of people will write that off and say, well, they were just out 2 days in September because they were sick, Nick. We don't need to even blink twice at that. And I look at their chronic absence rate from the year before, and they were out 30% of the year. Well, here's an opportunity to jump in and say, we know Billy's been sick. We've been missing him when he isn't here. We know last year was hard. We don't want this year to be the same. Let's chat. Anything we can do to help. If you have that conversation in September versus trying to have it today, it's really different. So don't write off 2 days in September like it's so easy to do. Early intervention is key to addressing chronic absenteeism. If you don't have a conversation with a family until you're sending some form of a truancy notification, you're working from a place of compliance and not from a place of connection. The last piece here is tier 3. And this is where in Vermont, right, we have CSP meetings, we bring in community partners. This is more intensive work. This is at young people missing 20% or more of the school year. So this adds up to be, almost 2 months of student days, more than 2 months of student days. So young people missing 2 months of school, 3 months of school. Even though it's scattered, that's how much time we're talking about here. So bringing in community partners at this level is essential. If you don't have your health partners at the table already, please have them there now. If you don't have your local mental health organization at the table there, please have them here now. Hopefully we've connected with this family and we've tried to understand more of what's happening for them so we can address their barriers. Last piece, truancy. Truancy court, this is written in Vermont legislation. It's being revised a bit now, but it's looking like it's going to stay relatively the same. Courts should be used as a last resort. I can't say that enough. Even in where I work in Washington County, we've got a great state's attorney and they're wonderful to work with and they really approach this work in the right way and they really care about families. All these things are true. And when a young person goes into court for truancy, the likelihood of recidivism rises. It is still true, this labeling theory, that when young people go into court and they are labeled as a truant, as someone who is a lawbreaker, that identity can still be internalized. And just because it's just truancy and we're just trying to get resources to the family, all this other stuff is still in play. So be mindful here. Yes, we need to follow the law. Yes, educational neglect is still a thing. It is much less of a thing than many of us think, but it is still a thing that we need to and are required to address. But when we talk about tier 3, please make sure we're not going the court route until you've done so many layers above this. So when we talk about how do we approach this, I really want to encourage this MTSS system. So as we move forward in our slides, the part about if we're talking about young people missing school, Heidi, are you watching NCAA basketball right now?
Oh my gosh, I know what is even happening. I just clicked on something weird. Hold on a minute.
No, it's okay. We're gonna pull up a slide on the ripple effect of chronic absenteeism, and I'll end with this part, and I'm gonna pass it back to Heidi. But missing school is not just about that one young person not being in school. It has a dramatic effect on the rest of your class, your grade level, and your school community. This ripple effect is real. And if you ask any teachers, if any of you are teachers in the classroom, you have the opportunity to spend time in classroom, you have kids in school, instruction slows down dramatically when you have high rates of chronic absenteeism. This churn of students coming in and out of class leads to so much time being spent and dedicated to reteaching content because 10% of your class wasn't there. It also goes more toward classroom management because you are having to relearn the rhythms of a day in a classroom, relearn the habits of what it means to transition from class, to transition to lunch, to recess. When young people are out of school, this churn is not just about that one student. It impacts your whole school community. It impacts your teachers who are sitting there and the content is going slower than it's ever gone before. You're not getting through as much content. All of these things impact the broader school community. And so I do not want chronic absenteeism to be seen as an opportunity for blame as to why other kids are not thriving. Let me be clear, that is not what this is about, but it is important that we understand when one young person is chronically absent, it is not just that kid who's impacted. When those families go to Europe for 2 weeks, it is not just, oh, they'll be fine because they have work to do while they're in Europe. No, they're still going to have to get reteach. They're still going to have time in class where it's going to need to be retaught and it's going to slow down instruction. All of these things impact our whole school community. So it is very important to understand the ripple effect of chronic absenteeism. So with that, I'm going to pass it back to Heidi. Sorry if I took too much time there, Heidi. Back to you.
No, that was great. Thanks so much. And keep the questions flowing because we're just about done and then we're going to have a few minutes at the end for Q&A. So feel free to drop questions into the chat. But I just wanted to come back. I mean, I think this pathway for change from attendance works that Nick walked us through is just a brilliant way to think about it. And I know we have a number of school nurses and school counselors and other community folks listening too. And I'd say this pathway for change is just as relevant for us who maybe isn't a school administrator or someone who's running an attendance team. For those of you who are school administrators and running an attendance team, again, to Nick's point, think about your healthcare partners throughout this pathway because we can support you in achieving your goals of getting kids in school, learning every day. Ideally, that's done from the earliest outset. But to my school nurses, school counselors, school-based mental health teams, community health folks, think about your own mindset and sort of buy into this process. Think about what data you can lift up to support an understanding of both trends across the school or community, but also for an individual kid. Do you have access to health information? Or could you look at your youth risk behavior survey results or other data sets that are more of a health lens that could help understand a particular student's or community circumstances and beyond? And then once we get to strategies, um, again, Nick showed this multi-tiered approach from Attendance Works. For those of you out there from the health space, you might think, oh, that looks an awful lot like a public health triangle, because it does. Same principle. There's universal supports and then up to tier 2 and tier 3 there. Luckily, Attendance Works actually has really nice resources. We're not going to talk about this in detail, but a future call in this series will. Things in the universal landscape mirroring what Nick was saying, is there a healthy school environment, cleaning protocols, access to health screenings, immunizations, connection for well child care? Those are all universal supports and up. And these are all tools in our toolbox that health folks can use as well. Of course, again, we're not going to talk about this in detail, but it comes back to data. As you look at data that make you understand what some of the reasons for absence are, that helps you understand as a school team, what are some of those interventions? And again, who are the partners you can build in? If you take nothing else away from this, and I hope that you'll take away that pathway for change and a knowledge, like schools do not and cannot do this work on their own. There are partners out there across the community who can help partner with you at each step along the way in this trajectory. So with that, our presentation's done. We're excited to stay connected with you throughout these series, again, with the spirit of we want kids in person, healthy, ready to learn every day. Through really strong school-based teams and leveraging partners, we can help folks achieve this goal so that our kids can be successful in school today and healthy for their long term. We have lots of resources out there that are linked in this deck. For those of you who have been on the Mentimeter, you should have been able to track through with us these slides, but we're going to get the slides and the recording up on our website too, and I will drop that link into the chat. I hope you'll join us for other sessions in this series. Again, really thinking about innovation from right here in communities across Vermont. And this is our email address if you want to reach out to us. So I'm going to end this presentation and stop sharing, and then I'm going to turn it back to Nick to take some questions.
Yeah, thanks, Heidi. We've got a little bit of time, and we wanted to create some space for questions. Folks can feel free to come off mute or put them in the chat. We've got a good amount of folks here, so I'd love to hear if things are bubbling up, what's on your mind. Again, we've got additional series coming up. And I think Heidi's also going to put an evaluation link into the chat as well, just so people have that so we can better understand if this content's helpful and what other things would you be looking for. So with that, I'd like to welcome anybody. And did we stop our recording, Heidi?
Yep, I'm trying.